Thanks for staying with us. So September is Childhood Cancer Awareness Month. This time of the year set aside to recognize the children and families affected by childhood cancers and to emphasize the importance of supporting research on these devastating conditions. Joining us on the show is Dr. Adedayo Joseph, who is a clinical radiation oncologist at the NSIA Luth Cancer Center. Welcome to the show, madam.
Good morning. Thanks for having me.
Good to have you on the show. So every year we talk about childhood cancer, which is something that many families dread. But could you give us some numbers that we're seeing today on childhood cancer, what the numbers are looking like, and how we can begin to push more awareness so that people know that it exists amongst us?
Okay, so thank you. That's a very good question. Numbers. I think the most important numbers to know about childhood cancer is that other countries, developed countries, have a survival rate as high as 90%. Wow. And we have survival rates ranging about 30% for children with cancer. And I think there's no number that summarizes the entire situation better than that, you know, and it is the reason why we have to continue to work to improve outcomes for these children because they can survive, but they are not surviving.
Okay, so when we hear cancer, we hear the cancer in addition with the pricing for treatment. What are the treatment options available, and are they readily affordable for parents?
Again, that's an excellent question because people talk to me about all these other options, alternatives that are out there. And the truth about it is that the treatment for cancer is surgery, radiation therapy, and chemotherapy. Chemotherapy includes many different types of chemotherapy. And when I say chemotherapy, I use it as a blanket statement for everything: hormonal therapy, immune therapy, and then the classic cytotoxic chemo that everybody knows and is sort of afraid of.
Scary.
Yes. In terms of availability, it's not as available as you would like it to be, but it is not as unavailable as people think it is. What I mean is that there are many times people haven't even tried to seek the right treatment, you know, so it is available. It may not be easily accessible or extremely affordable, but it exists in the country, better than some other countries. In terms of affordability, cancer treatment is expensive everywhere in the world, and it is one of the most common ways that a family goes into catastrophic bankruptcy. It is expensive anywhere you check it. The thing about it is that we don't have excellent health insurance coverage in Nigeria. But as things get better, hopefully that situation will improve, especially for children.
Dr. Dayo, aside finances, what other factors contribute to the low numbers of survival rates in Nigeria?
The single most important contributing factor at this point is because the children don't arrive at the pediatric oncologist until they have really advanced and incurable disease. And for a long time, we used to blame the victim. For a long time, we used to say that people don't present to the hospital early. They've gone to church, they've gone to pray. But what we have found with children is that they actually do present early. A child that is sick and is not going to pretend. And a parent, no matter their situation, will take their sick child to somebody they consider to be a healthcare professional. Unfortunately, that child gets treated for malaria and typhoid and over again, and then the diagnosis is not made. That is the single most important reason.
But there are some kinds of cancers that don't even present itself early. There are a few that you just think he's okay. You don't see any lump outside. There's nothing protrudes, and you just think the child is fine. How does the parent know or catch it early?
That's absolutely true, but it's more applicable to adult cancers. We don't want parents looking at their child, examining the child for cancer. Nobody wants to think about cancer and a child in the same sentence. And I don't really expect any parent to start touching their child and feeling for a lump. The truth about it is that much of our effort is directed towards healthcare professionals, so that when the child does see a doctor, the doctor knows that this is not malaria and is able to refer that child for specialist attention. What I do tell parents is that make sure that your child is seeing a pediatrician. If you have a sick child, you should be seeing somebody who is an expert at treating children. Otherwise, you're not in the right hands.
So, before I come to you, BC, I'm told that we have the survivor who's going to be joining us on the phone, Adekemi Oyewusi. Are you there? Hello, Adekemi. He's a childhood cancer survivor. Good morning, Adekemi. Are you there? We're still having technical issues. BC, go ahead, please.
Yeah, so I wanted to ask, what are some of the ways that parents can cope with children that have cancer? Is there like a support group? Is there somewhere they can go to and have, you know, understand that other people are in this together and we are working through it? Is there something that would at least encourage them to come out?
There are a couple of things. So first of all, in terms of support group, Dorcas Cancer Foundation has a very active support group for parents of children living with cancer. But what we have found is the single overarching concern for parents is the cost of treatment. There's no point in a support group when the parent can't afford to pay for their child's treatment. So to that end, we've done a lot of advocacy work. We've partnered with industry and private organizations. For example, the center where I work, the NSI Youth Cancer Center, gives all children a 50% discount. Yes. And, you know, we have those kind of advocacy programs as well. We have the Pediatric Cancer Access Program where the child doesn't pay a dime and companies and private individuals are paying for the entire treatment. So there are measures in place, but we have to get to the point where these measures are policy and not an exception.
What are the most common childhood cancer cases that you have? I mean, most adults have the breast, they have the pancreatic. What childhood cancers have you seen the most?
In children, the most common cancer is leukemia, and that presents with repeated infections, bruising. You know, the child is repeatedly ill. That's the most common way that you'll find leukemia. But there are other ones. Retinoblastoma is a common one in Nigeria. It arises from the retinal layer of the eye. Wilms tumor is a common one, which is from the kidney. And incidentally, is one of the most curable cancers in the world, Wilms tumor, yes. Even retinoblastoma, for a long time, I tell people that when I attend pediatric cancer conferences, they don't discuss survival. They talk about side effects and quality of life, fertility, long-term effects. They don't discuss survival anymore because it is almost taken for granted that the child will survive. You know?
So is for this through surgery or chemotherapy? Because a parent thinking, how will I put my child through chemotherapy? I mean,
it's a combination of everything usually. But this is what I have found. Children are more resilient than adults. They tolerate treatment better. They don't complain, they don't whine, they don't feel sorry for themselves. They're stronger than we think that they are. You would hardly...
Emotionally too.
Yeah, somehow. They're somehow able to just manage. I find in my personal experience working with kids, they actually cope better than adults.
Okay, let me take Adekemi Oyewusi. Hello, Kemi, are you there?
Yes, good morning.
Good morning. Thanks for joining us.
It's my pleasure.
And thanks for...
Well done for the good work.
Yeah, thank you for sharing your story with us. So tell us about your own story. What cancer were you diagnosed of, and how was the entire process for you to get to this point?
So I was diagnosed with Hodgkin lymphoma, and I was 8 years old. I was still in primary school, to be precise. So it started like malaria. I've been treating malaria for a while, going back and forth to the hospital. After some weeks, I was transferred to another hospital to see what it could be. And it was there that one of the doctors said, this has to go to a teaching hospital. So I moved to a teaching hospital, and that was when the whole thing was diagnosed. So I had 2 years of my life out of school because I had to be on admission and do my chemo rejection and all of that. Because I was quite young, I didn't know so much about what it was. And then I just knew it was Hodgkin lymphoma. What it was cancer related. I didn't know as such. But I was curious because of the kind of treatment that I was always subjected to. I mean, people around me look at me at the hospital and they are saying, though, I'm one kind of special child. So it was a lot of, how do I call it, a lot of trauma for me. I couldn't do like any other child. I couldn't play like any other kid. And especially when I had my head going off, it was kind of difficult for me because I just woke up one morning and I had that it had changed color and it was falling off. So that alone was another trauma for me. So it wasn't something that I was so much aware of. I just knew that I was under a lot of pressure medically and all of that. I didn't really know what was it that I was doing until when I actually got through that first stage after the 2 years, and I had to go back to the hospital, and I got to know more and more about what was it that I was being treated for. That was when I became aware of what it was. And since then, I've been trying to look for how to get people of my caliber that have it. You get, so I kept checking online, even as an adult, even now I kept checking online about it. And that's why I came about Dorcas Cancer Foundation, to be able to talk about it. Like, I've not really seen someone in my state that had it and I could relate the story with. For me, it was an entirely different journey for me.
All right, the line, thank you very much, Kemi. The line isn't so clear, but I think we're able to capture most of what she said.
Yeah.
I wanted Dr. Dayo to talk about this month's theme for this month's awareness, because I know this is a yearly activity?
Oh, okay, so the theme is children are gold. The color for childhood cancer is gold. It's a gold ribbon, the ribbon for children. And so it's just a play on words to say that children are gold. They're gold because they're very strong. They're gold because they're very precious. They're gold because they shine. You know, so.
Yeah, can cancer be avoided for children?
No, not really. There's no way to prevent cancer in children because they don't have the environmental exposure risk factors that adults have. Even in adults. So yes, you can get vaccinated and that prevents some cancers. And then maybe, you know, if you avoid smoking and you live healthy, but it's not 100% guarantee of protection, even for adults when you make healthy lifestyle choices. In children, it doesn't even apply because the cancer is at the level of the genes. There's no environmental exposure that has caused it. So you can't prevent it.
So, I heard there's something called Bracha Test, where maybe a family member died of cancer, and as a person, you can get tested and then preempt or know if your children might have cancer, and then you can begin to be aware. I mean, does that test exist in Nigeria, and how do you ensure that? Because if a woman is just getting married and she's having children, and she's worried that her mother died of cancer, and she's about to have children, are there anything she can do to...
So it absolutely exists in Nigeria. The first person that gets tested is the person who is diagnosed with cancer, right? And if that person is BRCA positive, then we then advise that they advise their family members who are at risk to get tested. It is available. It is expensive, again. And yes, if a person who doesn't have cancer gets tested and they are positive, then there are preventive measures that they can take, many different options. Yes.
Great.
So is there any test, no general test, you know, like the way adults go for yearly checkups to be sure nothing is wrong? Do they have that for children just every year?
No, again, we don't screen children for cancer because no, we shouldn't. It's not common enough to warrant putting a child through invasive, uncomfortable, frightening tests. You know, when there's nothing wrong. But when there is something wrong, you just need to find it early. You know.
So what can we do to support Doctors Foundation? Because I know that, I mean, every year Nima is quite active in that organization. I know she does.
Champion.
Yeah, she tries really to remind us all the time that this is good Doctors Foundation, do something, you know. So I see that, but what else can we do? Because the truth is that there are a lot of children out there that need help. They need resources.
You know, the thing about it that I say is that I just want, and I mean, my friends are from me, I just want everyone to be an advocate. Just talk about it. Bring up the conversation and have the conversation. If you're in the room with a policymaker, talk to them, ask them, what are they doing about, you know, cancer in children in their community or in their consistency? I don't know.
Consistency.
You know, so I just want everyone, at least for the month of September, be an advocate. Use whatever means you can on your platform, in your private conversations. Advocate for children living with cancer in Nigeria.
Thank you very much.
Thank you so much.
I think we can wrap up on that. Do we have any comments for her on social media? Because I know lots of people watch the show, and many of them are having this issue. The repeated malaria treatment, repeated typhoid treatment, and they don't want to accept...
It's diagnosed together, malaria and typhoid.
Yes.
It's
they don't
ridiculous.
want to accept the possibility.
If it's hereditary.
Yes. So,
It can be.
Wow.
It can be, but not very commonly. Most of the time, it's not.
so
But it can be.
someone said that there was a time, Andrew, in Street Time, saying, I remember a time when Nigerians hardly had cancerous diseases. It was only for the rich. Lord have mercy. Was this?
That's not true. What the reason why you think it was for the rich is because those are people being diagnosed. Those are people getting tested and the diagnosis was being made. It's not true that we didn't have. We did. We just didn't diagnose and treat it.
Let me wrap up with Kemi. Kemi, what's your final message to this morning for people who have children that are living with cancer and are trying to get it treated, or even children who are going through what you've been through? Is there any message for them this morning?
Looking at was a recording my university.
The network is really bad. We can't hear you. Want to try that again?
Hello, can you hear me?
Yes. Try to speak a bit louder. Yeah, go ahead.
Okay, so I was saying that my advice basically is for the parents of the children, because as a child, it may be difficult for them to express themselves. So I'll just see that the parents keep being strong for the kids. And I hope that our health sector can get better to able to support this. It is really, really dead, to be honest. It's not an
Thank you very much, Kemi. Any final words for us, Dr. Joseph?
Be an advocate.
Okay. All right, that's all we can take. So as we said, be an advocate this month. We're talking about childhood cancer. Wherever you are, let's remember that there are children living with cancer and they need support in every way they can. And also, if you're having children who have repeated malaria, repeated typhoid diagnosis, please take them to a specialist because you just might need better treatment and care. That's all we can take on the show today. We'll see you tomorrow. Bye for now.